going fast, huh? As they're almost done.
I know.
Crazy. Alright, so the techniques, again, we'll go pretty fast because it's kind of the same thing that we just went over. We just need to talk a little bit about the equipment. So most dental patients, the biggest source of anxiety is the shot. And they'll tell you, oh, I hate dentists. Nothing personal, I hate dentists. I hear that once a day, if not every day. But again, a lot of improvements have come along with dentistry, and dentistry is not what it used to be, 50 years ago. We can do a lot with the anesthetics and with the equipment that we have. Again, local anesthesia provides a pain-free area for us to work. Topical anesthesia, again, it's the surface. Applied prior to the local anesthetic, the material is used to desensitize the oral mucosa before the needle stick. Okay. This is the syringe that we use. It's called an aspirating syringe. You guys will put one of these together. It's designed to aid the operator in positioning the needle in a safe position prior to depositing the anesthetic solution. This type of syringe contains a harpoon at the end of the piston. The harpoon is designed to penetrate the rubber stopper on the end of the anesthetic cartridge. Once the needle penetrates the tissue, the thumb ring is retracted, creating a negative pressure. If blood enters the cartridge, the needle has to penetrate a blood vessel, or the needle has penetrated a blood vessel that must be repositioned to avoid injecting the anesthesia into the blood vessel. So who's given blood? Anybody or had lab work done? Yeah, so what do they do? Go right here. Yeah, and then what do? They put the needle in, and then what? They let go of the band, but when they put the needle in, they get what? Blood, right? So that tells them that they're in the vein. When we're anesthetizing, we don't want that. That's not a good thing to inject the full carpule in the vein. You're going to have a not very happy patient, maybe a dead patient. Okay, so that's why it's called, that's why it's called an aspirating syringe. Okay, and I'll show you right now. You inject, and with our thumb, we aspirate, draw back, creating negative pressure to see if we're in a vein. Or even if you give a intramuscular injection, you inject, draw back your syringe, make sure you're not in a vein, and then you inject your medicine. Okay, but that's why it's called an aspirating syringe, so that we can avoid being in a blood vessel. And you'll see the dentist when they're injecting, myself or Dr. Cervantes, will aspirate 2 or 3 times as we're injecting. Sometimes the patient will move and your needle moves, so you just want to re-aspirate, make sure that your needle didn't move and go into a blood vessel. Okay, so here's your thumb ring, here's your harpoon, okay, and your cartridge goes in here. This piston goes through and the harpoon goes in the back. Okay, so here's what the syringe looks like. Your thumb goes in there and you hold it. Here's what a positive aspiration would look like. You go in there, you aspirate, and that cartridge will turn red like pretty quick. Okay, so you'll see the blood come in there, and that means if this were to happen, I take it out, put a new cartridge in there so I can tell when I go somewhere else if I'm in a new vein or the same vein. But you don't want to get that. Or so if I just go a little bit and I see a little bit of blood, I'll stop, pull out, move it, go somewhere else, re-aspirate. If I don't get anything, then inject there. Okay, but that's why you need that thumb ring, and it has to be, that harpoon has to be on the rubber stopper, and I'll show you how to do it. Because if I go in and you didn't hit that rubber, or get that harpoon engaged, if I go in and I aspirate and that harpoon isn't injected, it's not going to draw back on me. So guess what? I've got to take it out, tap it, and then re-inject. Okay, so the patient doesn't like it. They don't like to be poked once, much less twice or 3 times if you didn't load it correctly. So we'll go over the loading. Okay, the needle penetrates the tissue. We direct the tissue into the area that we need to numb up. There's a short and there's long needles, and we'll talk about those. Depends on mostly the preference of the dentist. I personally use short needles up on top, and I use long needles on the bottom. On kids, I use short upper or lower, but on adults, I use short on top, long on the bottom. The cartridge, again, that's where the anesthetic is, called also a carpule. Okay, again, the needles are short. Red are 25 gauge needles, that's the diameter of the bore. Yellow, which is what we have, we normally have yellow long needles, which are 27 gauge, and we have 30 gauge short needles. These are the two that we have. So we have 27 long and 30 short. And again, the number is how thick the needle is, the bore. This is what you need to set up your syringe, your aspirating syringe, your cartridge, and a sterilized or unopened needle. Preparing the syringe, instruct the dental assistant. The dental assistant should prepare the syringe out of the patient's view. Obviously, you don't want to be in front of it. Oh, look at my needle, and this is what we're going to inject. Yeah, always, and we always set it up behind the patient so they don't normally see it. Some offices you'll walk in and they'll be like right there, right on the tray table. Patients,
you know what's coming, yeah.
Yeah, like, patients will see that and they take your blood pressure and it's like 20 points higher. The topical anesthetic is applied by either the dentist or the dental assistant. With me, I normally apply it with Dr. Cervantes. Jesse applies it. What you need is a sterile syringe, disposable needle, anesthetic cartridge, and a 2x2 gauze. I think there's a question, I don't know if this is a TP. I may be filling the blank. I think, possibly. For some reason it rings a bell. Procedure. Okay, you select whatever you're going to use. Remove the syringe from the bag. We'll show you how it's done right now. While the piston is fully retracted, load the cartridge into the barrel. We'll go over that. Push the. This is when you put the cartridge in there without the needle. That's the best time to insert the harpoon. Okay, because nothing. If you press on it, that harpoon's going to go in. You don't have a needle for the liquid to go out. Sometimes you put the needle and then the cartridge, and then you've got to tap it so that it engages. Okay, and we'll go over that. Remove. You want to kind of loosen the cap from the needle. We'll go over that. We'll go over that. Okay. Again, verify the type of anesthetic that's going to be used. What you need the patient chart, and then all the basics. Topical anesthetic, aspirating syringe, anesthetic cartridge, and the needle. The procedure, you seat the patient, review the medical history, again, to see what anesthetic you can use. You can apply it topical. Try not to use the words shot, pain, injection. I normally use, to kids, I normally say I'm going to put some sleepy juice on your tooth. Okay, try to avoid those words because they don't like that. Dry the oral mucosa with a 2x2. Put your topical solution on there, and we're going to administer it. Okay, if you're passing the syringe, which some doctors will have you pass the syringe to them, we'll go over how you do it properly. It's done again in the transfer zone, below the patient's vision, below the chin. Okay, in the same area, the doctor's going to have his hand right here. You're going to bring and you're going to put the syringe over here on the patient. Okay, you're going to give it to the doctor right here so he can go into the mouth. We'll go over this. As the dentist pulls the syringe away, you remove the cap so that he doesn't have to go here, take the cap off, and then go in. It's all done in one motion. We'll go over that. Then we'll show you how to recap it. You never want to recap like this. This is the most common way to kind of poke yourself, because you're either capping or recapping or uncapping after you use a needle. Okay, so you never want to do this. You always want to scoop it, put it down on the counter, scoop the needle. Okay, and sometimes you scoop it and the needle gets away from you, and you just chase it till you hit the wall, and then never hold it, because you'll poke yourself, I guarantee you. It's not a matter of when, or not a matter of if you're going to poke yourself, it's just a matter of when you're going to poke yourself. So you always want to be real careful. Rinse this one. A lot of assistants sometimes forget to do. After we pull out of there, your job is to rinse the patient out. That anesthetic doesn't taste very good. It's pretty bitter. Okay, so go in there, rinse them out, and get that taste out of their mouth. And we'll show you how to unload it and how to take the needle off. The best way to take the needle off is either a hemostat, or I'll show you how to unscrew it if you don't have a hemostat. But again, you need to be careful. Prepare for sterilization. Again, recapping. Just be careful. Always recap by scooping it. All right, ladies. Oh, you know what? I didn't print the quiz. Or did I? No, I didn't. I mean, yes. No, I think it's on in the printer in the office. Questions? Bless you.
Thanks.
The volunteers can have a demo. We'll do infiltration, ASA, MSA,
That's messed up.
PSA,
Okay.
buckle, mental.
Yeah, I'll mentally go crazy.
Mental. We'll do the nasal palatine on you,
Oh, God.
and the greater palatine on you. And we have just enough. Perfect.
No, thanks.
Everybody can get a little bit.
Or we could all practice on you.
They don't bother me.
Oh, you said that now.
We don't do it right.
I have my still like anesthesia.
But you have.
I just had a little outpatient general surgery.
Oh, physician or dental?
No, physician.
Oh.
They put me to sleep.
Ah.
I woke up. I had a very bad mood.
Ooh.
The next day, I thought I got hit that truck. Like my throat hurt, my jaws hurt, and they said it was from the muscle relaxant to do the airway.
Oh, well, yeah.
Well,
if
thanks
you
for
were
not telling me yesterday
you were
that I was
intubated.
gonna feel like that today.
You were intubated, yeah.
Because I thought I was called 911. I thought I was dying. Oh my God, they killed me. Because I started coughing and there was all this pain in the morning when I woke up. I was like, something's wrong. And then I called the surgery and I'm like, oh, that's normal. I'm like, yeah. I'm gonna put that on the little list of things.
It's in the fine print way down there. It says, tomorrow you're going to feel like crap. Topical or local? Which one's which? Where does the needle stick happen? On the surface? Yeah. So the topical anesthetic is used again to minimize the needle stick when the patients are afraid. And local anesthesia numbs up the local area.
See, it's right there.
What were the other ones?
The answers and the question.
Yeah, answer or
Yeah,
any
it
questions.
was, yeah.
Okay, so what means tissue death, loss of blood supply, bacterial toxins, or physical chemical change? Necrosis, B. Also known as root canal treatment, involves a surgical removal of the vital pulp from the tooth. That's pulpectomy, and removal of the tissue that's in the crown of the tooth is pulpotomy. Flipped around. Again, pulpotomy is just the crown of the tooth or the chamber. Pulpectomy is going inside the roots, doing a root canal. Right?
Think
All right.
about which one's more severe. To me is the more
Good,
severe.
yeah. All right. See you after lunch.
It's my guess now.
Like it's so fun.
I know, it's really gonna be quite a trip, but I'll do it. I know, I got all my gym clothes and I was like, I'm gonna get all this gym clothes out, I should drive people to my door tomorrow.
There is one test that you had given us back a while back, because Constance or she did take it now, but
She's missing one part though. She still hasn't taken one part.
because I want that test back.
So
I'll
get her to take, she
Well,
took,
I asked her this morning, I said, did you ever take that last test? She's like, "Oh,
she did
I
take it,
last
but
week."
she didn't,
Do it a different part.
one of the labs, she said she didn't go over because she said it wasn't in the video.
Okay, then you can have some of this one, then you gotta retake this part of it.
I think it's in there, it's just that it was one part of, he didn't separate the video, it was just one part of the
Oh,
video.
okay.
So I don't know if she didn't see
Okay.
it or what.
I'll remind her and I'll tell her. Thank you.
Hey, you tell her, because I want
Thank
just
you.
got two.
Take this, we're gonna take this, put this in the room as well. And, this one, not part of this kit. So, yeah, you can just what I have right here, just set it in the room, except this. Everything else, yeah. And so I'll go over all of this and these ones are the school ones, okay? So those sterilize it and put it back in there. So this is the schools, everything else except this goes there, except this as well, this is for the school.